Well, thank you for watching our PolicyCast. This relates to the Affordable Care Act, which is, of course, the major health care reform legislation that Congress enacted and the President signed into law 2 years ago this month. We think it's very important legislation for New Mexico and for the country, and we wanted to have a chance to explain some of the provisions and the time frame. We also have that time frame set out on our website for anyone to follow that has an interest. Well, the legislation will be very helpful to New Mexico children and families that have children. It does so in several ways. First of all, there is in place already, as a result of that act, a prohibition against insurance companies denying coverage to children because of some pre-existing condition that the child might have. So if a child has a particular condition that has in the past made it difficult for them to get insurance, this legislation prohibits insurance companies from denying them coverage in the future. Another provision which has also been helpful to us already in New Mexico is the provision that says that students or young people who are on their parents' insurance policy can remain on that policy until the age of 26. And that is an improvement that allows the parents will have to continue to cover or pay the premium, of course, for that coverage, but it does prevent that person from having to go out into the private insurance market and try to obtain their own insurance. So we have over 20,000 New Mexicans who we believe have taken advantage of this already. It's I think over 2.5 million nationwide have taken advantage of this. So this is also helpful to families with children, particularly children 26 and 26 years of age and less. As to seniors, it does improve the benefits available under Medicare, traditional Medicare, by saying that certain preventive services, such as an annual checkup, a wellness checkup, mammograms, colonoscopies, those types of services will be provided as part of the Medicare coverage. So this is good. Also, we began this last year to phase out the so-called donut hole for prescription drugs in Part D of Medicare. Now this, people who have signed up for Part D of Medicare and are obtaining prescription drugs know that after they spend a certain amount on drugs, then they fall into a so-called donut hole where they have to pay the entire cost of any drugs they receive for a period. This is narrowing that so-called donut hole, and under the law it will be totally eliminated by 2020. So this is a benefit to any senior who's participating in that prescription drug program. Well, there's a great benefit to our state from the legislation in that we are next to Texas. Texas has the highest percentage of its population uninsured of any state in the union. New Mexico, unfortunately, is second highest percentage of uninsured. About 26% is the estimate for New Mexico. 26% of our population has no coverage. Under this legislation, that would be dramatically reduced, and individuals who are not currently covered would be able to get coverage under Medicaid if their income was less than 133% of poverty. If their income is above 133% of poverty, but less than 400% of poverty, they would get a subsidy to help them pay for the premium on insurance, and they could buy insurance to obtain coverage that way. So the idea of the legislation is to get everyone covered so that we don't have so-called free riders, that is, people who have not gotten coverage but who get sick and wind up in an emergency room or in the hospital and not able to pay the very high medical bills that they incur. So we're trying to get away from that circumstance. Obviously, when that does happen, and someone does not have coverage and is not able to pay their own bills, then the cost of that gets loaded on those who do have coverage. And that's not a fair arrangement, and we're trying to get away from it through this device of getting everyone covered either through Medicaid or through the private insurance market through these subsidies that can be provided depending upon your income level. Well, the Affordable Care Act really takes full effect on the 1st of January of 2014. So we're still a little over a year and a half away from the bill, the legislation having its full effect. And by then, the idea is that each state, New Mexico included, will have a so-called insurance exchange where any individual who is not covered by their employer, doesn't have insurance coverage, can go and shop for the various options available for insurance, can sign up for Medicaid if they're eligible for Medicaid, can obtain the subsidies that are available through this legislation to buy private insurance if they're not eligible for Medicaid. So all of that will become available for individuals to take advantage of beginning January 1 of 2014. During the next year and a half or so, the state obviously will be going through the preparations to establish this insurance exchange, and we hope that we can take that time to educate everyone in our state on the opportunities that this new legislation provides to them. That gives you some overview of what's involved with the Affordable Care Act, particularly as it affects us in New Mexico. I appreciate your interest in this legislation and what we're doing here in Washington. We have a lot more information about the Affordable Care Act on our website. We encourage you to look at that, and there are links to some even more in-depth information elsewhere. Again, thanks for watching.